Hip replacement surgery takes between 1 and 2 hours. That is the surgical time. There will be additional time for preoperative checks, anaesthesia, as well as recovery. So the hip joint is a ball and socket joint, which comprises of the femoral head and the acetabulum, which is the socket. Hip replacement surgery is undertaken when that joint becomes worn out due to a number of causes, the most common being osteoarthritis. Essentially, hip replacement surgery is the excision of the worn out femoral head and acetabulum and replacement with a prosthesis that consists of a cup, femoral head, and femoral stem. There is a number of ways to do this. However, the principles of this have remained constant over the last 70 years. Last year, there was roughly 50,000 procedures undertaken, and it significantly improves pain, mobility, and quality of life. Despite this, it is still considered major surgery, and you will be evaluated by your treating orthopaedic surgeon, anaesthetist, as well as other medical specialists as required prior to your surgery. The risks commonly include that of infection, dislocation, clots, fracture, and loosening. Despite this, it is successful in approximately 90% of people and now has a lifespan that can be expected to last 10 to 20 years.